Good morning, everybody, on this Monday morning. I hope you're all having a good morning so far and that you brought your earbuds to school. So today's lesson, we're going to have two lessons today. The first one will be on the different types of depression. And then after that, we will be talking about the warning signs of suicide. After class today, there's an assessment on the types of depression. Make sure you use your notes on that if you need to. There's an article to read about suicide. And then the last thing you need to do today is to finish the flashcards on mental illnesses that I assigned on Friday. Actually, on Thursday. So here we go. You'll have to have your notebook out. And one more piece of information. We're getting to nearly to the end of this mental health or total health unit. So on Thursday, we're going to be taking an open note test. That day, your notebook will also be due that day. And here are the notes that you're going to get to use on the test. By Thursday, we'll have all of these in your notebook. So we're not quite done yet, but make sure before Thursday you have everything in your notebook that you need for the test. It is open notes. So our last topic, we've learned about what causes depression. We've learned the signs and symptoms. So now we're going to learn the different types of depression. So on slide 19, you are going to write your EQ. What are the different types of depression? So the first one is manic depression, or better known as bipolar disorder. This is, they say, the hardest of all types of depressions to treat, but it is characterized by alternating periods of hyperness and hopelessness. So their moods, it's sort of like a roller coaster of moods. This type of depression is obviously really hard to live with for both the person suffering from it and their family members and loved ones, because they just don't know what kind of mood they're going to be in that day. So, and then in both stages, it can be very dangerous and risky, because even during the hyper stage, when they seem like everything's going great, they might be extremely happy. They might be doing very risky behaviors, like maybe driving really fast or taking drugs and alcohol they normally wouldn't do, or maybe going on to some spending sprees or gambling sprees and spending all their money. And obviously, during the low stage of their bipolar, they could be at a risk for harming themselves or taking their own life. So that's the bipolar disorder. Next one is major depression, sometimes also called clinical depression. This is a constant deep depression. So with manic depression, it affects every single aspect of the person's life. Sometimes it's even really hard to get out of bed in the morning. They might isolate themselves. They really are completely hopeless, and they believe nothing can make them feel better. Some of the outcomes or consequences, I should say, they will probably have some physical changes, either a lot of weight gain or weight loss. They may quit taking care of their hygiene, so they may be wearing the same clothes all the time, not taking showers, things like that, because they just don't care, or they don't have the energy to do those things. And the other one is really hard to understand, but they really almost feel nothing inside. Like there's no emotions. They just kind of feel blah, numb. I can't even imagine what that must feel like. And if this is not treated, it can lead to life-threatening thoughts and actions. So it's so important to ask for help to get treatment, because nobody should have to live like this. Next one is dysthymia. So this is the most common form of depression. It's characterized as a constant low-level depression. So it's not nearly as serious as major depression. The person can still go on with their days, doesn't interfere with their days too much and their activities too much, but person who suffers from this just never feels really happy. It's just like a constant sadness, causes low energy. They may feel like they don't want to do much. And it can lead to major depression if it's not treated. So even people who kind of have that low-level depression, it's so important to get help. The next one is post-traumatic stress disorder, PTSD. We all have heard about this. I'm sure when you hear this, we often think of veterans, people who've experienced war, but it can really happen to anybody who experiences a shocking, scary, or dangerous event. Some characteristics of people with PTSD is that they'll have flashbacks at any given time, and it actually their brain takes them back to the time they experienced that trauma, and those thoughts can go over on and on in their mind. Many times they'll wake up with nightmares, horrible dreams, a lot of frightening thoughts. So this is something that they've done a lot of research on in the last few years, and they've come a long way with treatments. And the last one I talked about the other day is SAD, seasonal affective disorder. This is the disorder because of the lack of daylight can affect the neurotransmitters, and it may cause a low-level depression during the long winter months in these cold states like Minnesota. So it's important to get outside, get fresh air, get some sunlight and daylight to prevent this. All right, now this is where I'm going to stop the video, and you're going to watch this video on your own. During the video, write down 3 do's and 3 don'ts when helping somebody with depression. It should be the next slide when you click to go on. And then after that, you will complete this slide. How do you think your parents would respond if they suspected you or one of your siblings was suffering from depression? All right, when you are done with this lesson, move on and listen to my warning signs of suicide lesson.